I have two questions. First question I have is directed to the first panelist. You were talking about a lot of costs that are associated with in terms of caring for a lot of different patients that you have. In terms of preventative care versus the care that you have for people who already have, like in terms of cancer and different things of that nature, what are the costs? What's the cost differential versus like being able to give people preventative care versus to have care for people? And the second question I have, well, a more broader question for all the panelists, anyone you guys can answer, is that don't you feel that in terms of the healthcare itself, it's not just, it's gonna fail more if we don't have a culture change where we're not being able to police more of like what's being taken in for a lot of people, Americans today, in terms of what we eat, how we live, different things of that nature. And I feel that if healthcare reform is gonna work, it has to be a culture change. We have to change our habits to be able to get to a much better point in terms of the whole scheme of how we're supposed to take care of ourselves. I think that's about it.
So you're absolutely right in saying that prevention is cheaper than care once someone has gotten sick. The challenge is that the specialists that treat disease once it's happened, a lot of times are not the primary care doctors that would see the patient in a preventive mode. So if we have a shortage of primary care doctors, you have nobody to be able to do those kind of preventions. So that's one of the challenges. And one of the things we're working with is how do you support the primary care world when you come from a specialty world and give them up front. And the reality is there's just not enough people to do it. Screening, colonoscopy, there was colonoscopies that were canceled. Colonoscopy screening was canceled because the hospital that was adjacent, that was nearby for people who were screened, did not get paid enough by Medicaid to pay for a colonoscopy. They just to turn on the equipment and to have the staff, and they couldn't afford to take the number of people that wanted a colonoscopy. So it gets down to the reality of you can try to offer as much as you want, but if on the flip side you're not recognizing that there are real business costs involved in providing some of these services, not even getting into the Walmart and the Nordstrom question, but there are basic business costs, then we're not going to be able to do the ideal. And that's that balloon getting squeezed and popping on either side.
So you talked about culture change, and I think when you're talking about preventive care, especially in our community, even those of us with healthcare aren't very good about the preventive side of things. So I think we need to do it and I don't know how we do this, it's difficult, but we need to do it some work on getting our community to understand how important preventive care is, regardless of whether we're talking about healthcare reform. If you listen to urban radio, you will often hear these things that go on a Saturday where we're talking about come and get this screening or that screening. And the reason why we do that is because we just don't do a good job. It's not something we're acculturated to doing. So I think, yes, that would, preventive care versus, crisis care is obviously, I think, less expensive. But culturally, if you're talking about a shift, that's what we need to be doing in our communities. And I don't know if government is really going to be able to do much about that. I mean, that's not really what we do in government, but you can do that. You can help by spreading the word in your community, talking to people. And this discussion is really not just about government, because I think we talk a little bit too much about what government can do without talking about our responsibility. We have a responsibility towards one another that I think to too large a degree we have not taken that responsibility on. So I think, yes, of course, preventive care is less expensive, but the cultural thing is something that especially groups like sororities and fraternities who are concerned with, as part of their mission, what goes on in the community should really be looking at, because nobody else is going to be doing that portion.
I guess I would strongly echo what you say, and I'll give you a couple of examples. When you see these statistics about the cost per capita for healthcare all over the world, boy, you got to really drill down and challenge that. I'll give you an example. In Cuba, children, before they start to school, stand up outside, they brush their teeth, they use a fluoride rinse, they expectorate into a cup. Are we going to do that here? Probably not. But the estimate, if you did that in the United States, would save over $50 million in dental care alone. Why do women in Israel have about 12% of the cervical cancer incidence we have in the United States? Go look at other countries about diet. So you're absolutely right on in inherent to whatever.